huh? This is strange. They started with the mistakes before they've even told me about what I need to do. Yeah, welcome back and welcome to Module 5. Let's get right into this. What we're going to hit you with is the 3 most common mistakes and misconceptions that patients of ours have in relation to their home oral hygiene.
Number 1. Most people believe that bleeding and soreness when they follow their oral hygiene routine means that they've done something wrong. People start flossing gums which are inflamed and have been probably for months or years. They spit blood into the sink and they think they've been too harsh to their gums. But funnily enough, it's the exact opposite. It's a lot like when you had a spot or pimple on your skin as a teenager. That's a sign of inflammation. Do you remember that from just a few lessons ago? Your body has brought blood and pus to the surface in an attempt to defend you. We don't want to cause bleeding, but the bleeding is kind of your body's way of flushing out the bad stuff. You're helping your body fight the problem by clearing the plaque and toxins. You're not harming it.
The second most common mistake is that to clean well, your teeth need to be scrubbed. In actual fact, that kind of puts fragile gums at much higher risk of gum recession, and it often means you skim over the areas in between your teeth and all the fine details. And remember, those are the areas where the most nasty and the most harmful bacteria accumulate the most and the most quickly. So you don't need biceps and shoulders for this.
You haven't got any.
And you're not the Incredible Hulk. Yes, I'm not the Incredible Hulk. In actual fact, we often recommend locking out your elbow and working with your wrists and your fingers only. This is not tennis, it's arts and crafts.
The third most common mistake is that people worry about previous dentistry they've had done, such as crowns or bridges or veneers or even implants. They often tell us that they were worried they'd dislodge something and create yet another unforeseen dental bill. If that sounds like you, we completely understand how you feel. And that's exactly how Kim here felt too. She had been so worried about dislodging these crowns or disturbing these already loose teeth that she barely touched them when brushing. Not only is this tooth now suffering with gum disease, but it's also got soft decay invading beneath the crown. All in all, like Kim, the financial risk and biological cost, by the way, of you losing your teeth is far greater over your lifetime. Besides, if something is going to fall off your tooth, it's probably more likely because of the 60 kilograms of chewing force that you're putting into it every single time you bite and chew your food. It's very unlikely that your brushing, so long as the technique is ideal, will be the final straw. Related to this, did you know that any type of dentistry tends to create a ledge or a step where it joins the tooth surface to seat on the tooth or bond to it? That ledge is yet another area where biofilm loves to build up. And yet another reason why removing it carefully and thoroughly is essential.
So, to reiterate and overcome the 3 most common mistakes and misconceptions, number 1, if you spit blood into the sink when you brush, look in the bathroom mirror and check where it's coming from. Focus on that area more when you follow your daily self-performed care routines, not less. Number 2, you don't need to scrub to clean your teeth thoroughly. It's all about the wrists and fingers, not your biceps and your shoulders. And number 3, clean 360 degrees around every tooth. Avoiding certain ones with crowns and bridges and veneers and implants is gonna be a super costly mistake. With those things in mind, let's give you the lowdown on your gum pocket brush. Hit the button for the next lesson now.